131197.
Rolling up a sleeve for science. More than 1,000 people took part in the Oxford vaccine trial.
We're seeing both neutralizing antibody responses and T-cell responses that we are optimistic may be associated with protection.
Which means the vaccine may not only block COVID infections, but help the immune system fight it. Weeks after vaccination, researchers saw peaks in antibodies and T-cells, which neutralize pathogens and kill infected host cells. What's not clear is how long those will last.
The difficulty that we have is that we don't know how strong that immune response needs to be.
So now it's on to a phase 3 trial, which is much larger and will determine whether or not it's truly effective. That will happen in places like Brazil, which has the world's second highest infection rate. This virologist is optimistic.
This is quite important to see if the vaccine is efficacious in protecting from infection or protecting from disease. And this will be crucial. And unfortunately, we need to wait.
Life is coming back to the streets of London, but experts say it won't return to normal until there is a reliable and widely available vaccine. And that's unlikely to happen this year.
There are 22 other vaccines in the clinical trial phase around the world, including one here at Imperial College in London.
pH might be different.
The project leader says it's important to have lots because many will fail, and because scaling up production will take time.
We still need to be aware that there may be a big gap between that announcement of a success in a vaccine to making it available to different parts of the world.
The UK government is attempting to get a jump start, already placing orders for 190 million doses of 3 different vaccines, including the one from Oxford. None have been proven effective yet. Renee Filipponi, CBC News, London.
Okay, so let's dig into this a little more with infectious diseases specialist Dr. Isaac Bogosh, who, as you can see from the forest behind you, is not joining us from his office. He's in Georgian Bay, Ontario. So let me ask you, Dr. Bogosh, I mean, how long until we can go into a pharmacy and get a vaccine?
It's still going to be a while, unfortunately. We still have to wait for the phase 3 clinical trials. Of course, the vaccines have to be mass-produced. They have to be shipped, and then they have to be administered. So I think if everything goes perfectly, and of course we know that's rarely the case, but if everything goes perfectly, maybe we'd see vaccines being administered in the latter part of 2020. I think a much more reasonable option is the first quarter of 2021.
And would it be the case then that we would see a kind of staggered rollout where only certain, I guess, priority people would get the vaccine first?
I think that's exactly what we're going to see. And there is a vaccine working group, and we'll very likely see prioritized cohorts of individuals. For example, those in long-term care facilities, people who might be in homeless shelters, probably frontline healthcare workers, people who are at greater risk of having a poor outcome of this infection, or people who are at greater risk of acquiring this infection. I think that's what we'll very likely see.
Okay, Dr. Bogosh, good to talk to you, and we'll be bringing you back into the conversation a little bit later in the program, so don't go too far.
Sounds good.